My name's Ruben Hart. I'm a pharmacy technician that works in sexual health and HIV for Kent Community Health. I started in the NHS as a Business Administration Apprentice. That took a year and involved me rotating through the different areas of GP surgeries. Once I completed that, I took a full-time job working in the prescriptions team, which involved processing repeat prescriptions and dealing with prescribing related queries from care homes, pharmacies and patients. From there, it was suggested to me that I had a clear interest in medicine and pharmacy generally, so I completed a level 2 dispensing course. That then rolled on to my MVQ level 3 in pharmacy. I then joined what was the CCG and now the ICB, working in the medicines optimisation team. I was there for 3 years and progressed to senior technician, bringing me to now where I joined Kent Community Health. I now work in the Sexual Health and HIV team. In my first full-time job dealing with prescription queries, I had to look up the different drugs, what they were used for, and I think I just had a bit of an interest in it. And then as I've done my training, that's given me more knowledge to then understand the different drugs, what conditions they're used for, side effects, giving patients counselling and things like that. With Kent Community Health, so I'm working in a community trust, which is a bit unusual for sexual health and HIV care, because usually that's in a hospital. We, as a community trust, don't have physical medications, so a lot of the role is around arranging supply of these medications through home care. So a lot of that is around prescription management, ensuring that patients have got adequate supplies of their medications, looking at drug interactions, particularly with things like their GP prescribed medications. Sexual health and HIV can be quite confidential, so GPs might not necessarily be aware of the treatment that they're taking with us. So we have to be sure that the drugs that they're supplied with from the GP doesn't interact with their HIV medications, or if there is something that could cause an interaction, then we liaise with consultants or GP surgeries to get something changed. Review patients for their medicines as well, make sure there's no interactions, and also just put their mind at ease. Other areas, sexual health stock. We have to ensure that they've all got stock at the right times for when they're seeing the patients. We also deal with the acute hospitals, because they do sometimes supply emergency prescriptions for us. So again, liaising with them around what supplies they can get. We've got consultants, nurse specialists, and healthcare assistants and us. So it's a good multidisciplinary team that can support the patients. The patients that we deal with can essentially be anyone. We have patients that are young, we've got patients that are older because they're living longer, healthier lives with HIV. Regardless of ethnicity, age, sexual orientation, we will see pretty much anyone and everyone. Patients will attend for sexual health screening, at which point HIV prevention might be discussed. So patients that are diagnosed with HIV will attend regular appointments with us to manage their condition. So HIV is managed by medication, reduces the patient's viral load until they are undetectable. So my role benefits the patients, or even just as a team, we benefit the patients. Sexual health, it encompasses all of that. So patients aren't having to go between hospitals, GP surgeries, other clinics. We deal with everything. But sometimes if they're having other health issues, that may then impact their HIV care. So we want to make sure that they're healthy, they're happy, and that they remain undetectable or treated